Hello, and welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Hello again, everybody, and welcome back to the Surgical Assistant Podcast. Joining me tonight is Dr. Terry Herring. He's the director of the Fayetteville Technical Community College Surgical Assistant Program, and I invited him on to tell us all about his program. So any of the listeners out there that are interested in becoming a surgical assistant, hopefully this will answer your questions. So Dr. Herring, thank you for joining us. I appreciate it.
Hey, John, thanks for that introduction. Yes, I've currently served as the division chair for surgical services at Fayetteville Tech. Been there 23 years, so I'm a sort of a dinosaur. Before that, I actually worked with a medical company as a product specialist, and I obtained my doctorate degree from Eastern Virginia Medical School.
Excellent program. I work with a lot of EVMS trained surgical assistants now.
Okay.
So when did you say that you first, that you took over the surgical assistant program at Fayetteville?
Well, I was the one that started the surgical assisting program. We had a surgical
Wonderful
program, and the surgical tech program is 50 years old. So in 2019 was our first year starting our surgical first assistant. So I actually developed that program and been the director since then.
Oh, that's fantastic. And is your program just local, or is there an online portion? Can people do it in an online fashion, like something like Meridian or Madisonville, or do you have to be a matriculated student and actually go to your campus?
John, actually, most of my students are the non-traditional students. They're online. Our program's entirely online. And then the clinical portion of the program is work-based learning. And
Okay.
work-based learning allows the candidate to be able to work and receive their pay and count their cases towards their requirement. And that was one of the things I was very concerned about when I was developing the program, because the surgical technologists, they work for 40 plus hours a week. So the WBL format is real convenient to allow them to do that.
Oh, that's wonderful. What are the prerequisites for admission to your program?
I do require an associate degree, and the associate degree can be in another area. I've had students with degrees in biology, credentialed as a surgical technologist, and 3 years of operating room experience.
Okay. So you do require that they're currently working in the role of surgical assistant or surgical technologist then?
Correct.
Okay. Sorry, my thing cut out on me there that I was using for my questions. Okay. Sorry about that. Oh, all right. Sorry. There we go. I made it too big. I can't see it. Oh, all right. Thank you. All right. Sorry about that.
Yeah, with this being totally online, so yeah, we do require them to be credentialed as a surgical tech. And the other thing is the work-based learning that allows them to use their current employer to get surgeons to precept them for their required surgical cases.
Oh, that's great. What is the total length of your SFA program?
It's a year. It actually starts in the summer, and during the summer, the students are enrolled in anatomy, SFA anatomy, and a pathophysiology class. And also at that time, they're enrolled in a pre-WBL class, and that's where they're videoing. They have to purchase a suturing simulator, and they're videoing suturing techniques and loading them up into our LMS, and I review those. And also during that time, they have some clinical skills that they can get a preceptor at their place of employment to precept them and check them off with those skills. And also the students they have available a SFA simulation laboratory manual, and all those skills are covered in that manual, as well as videos to help them hone their skills in suturing.
Oh, that's wonderful. And what credential does their preceptor have to have? Can it be a surgeon or another CSA or CSFA?
Now, for precepting, we do require it to be a surgeon. There is
Okay.
a form that the candidate will fill out and send it to me. And then I actually go on to the medical board and make sure it is a credentialed surgeon. But we do require a surgeon, a DO or an MD, podiatry to serve as the preceptor for the students.
Okay. And what is I guess, since you said it's a work-based learning program, is there a certain amount that is all didactic? Do they have to hit a certain didactic milestone before they can start their clinical phase on their work-based learning? Or can they start immediately with their didactic learning and their surgical skills as well? Or
John,
clinic, let's say.
is when they're doing that pre-WBL, so they don't actually
Okay.
start their clinical preceptorship until the fall and the spring. And they're taking additional SFA classes, but the program is actually geared to a full-time working technologist.
Oh, that's wonderful. I wish I'd have had that when I was younger. That would have been fantastic.
Yeah, that was one of
Um,
the main things that when I was building the program that was concerning for me.
yeah, I mean, if you're a surgical technologist working in a very rural area, or it's not easy for you to get into a program and there isn't anything close by, what are you gonna do? I'm glad to see that programs like the one you started are filling that niche and are allowing more people to progress on and do, something that they love to do, because I know I love doing this. What's the total Oh, I'm sorry, go ahead.
Interest grow, John. It's
Mhm.
starting to grow. And here in North Carolina, the role of the SFA was not that popular, but now we're starting to see more and more hospitals are reaching out because, again, I mean, surgeons are wanting surgical technologists to do a lot of things that's out of their scope of practice. So
Yes.
they're starting to see that this is an ideal model and it'll allow as reimbursement's not gonna go up, it's gonna continue to go down. So I think this model really allows the hospital to look at doing with those advanced practitioners such as your PA and nurse practitioners, better utilize those because the SFA can do the same thing they did during the OR.
Yeah, that's true. Yeah, I think that's a wonderful opportunity. What is the total cost of your SFA program?
Okay, John, the tuition for an in-state student is $1,662, and out-of-state tuition is 5,000.
Okay, wow, that's affordable. That is great. And I assume, being that you're a college and institution and a learning institution, that they're allowed to use student loans, federal grants, things like that. Can they apply for that stuff?
Because of the length of the program and the clock hours,
Mhm.
it's available for financial aid. However, program is we do have an outside vendor that we work with and set up payment plans. And of course, the thing that the candidates need to keep in mind, this money is not all due up front.
Oh,
And
okay.
the payment plan allows them to break it up in increments and make it much more manageable.
Oh, wonderful. That's definitely affordable. That's fantastic. How many students typically are in a class? I mean, do you
That's 20. I
20?
started at my cat was 5 while I was working on getting the program set up, and
Mhm.
we've changed our maximum to 20.
Okay. And how many classes do you run a year? How many first assistant classes a year? Is it one with 20 the entire time, or do you have one starting every month? I know some other programs have many per year.
Right. We have one entry date, John, and that's in the summer.
Oh, great. That's really good. I know when I was looking to become a surgical assistant, I think there were 7 KHEP accredited surgical assistant programs in the country, and now there's 12. So I'm so glad that people like yourself and others have made that opportunity available, because it was at the time there were only, I think, 2 online offerings and the others were in person, like
Yeah.
here at EVMS. And I didn't have a bachelor's degree, so I couldn't go to EVMS. So I'd been a tech for 25 years, so I capitalized on that experience and went to another school. But I really think that's fantastic. And I mean, sorry to sound sort of ignorant about that, but when they graduate your program, it's a certificate program. Is that what they graduate with, a certificate?
Yes.
Wonderful. Do you have any plans in the future to maybe offer an associate's degree in surgical assisting?
Well, I made it where they have to have an associate degree to come in.
Mhm, okay.
So, but I do get candidates that question or want to get the grandfathered in. But I just think, John, in order for our profession we've got to raise the bar.
I agree.
And that's why I say that we need to be at least a degree prepared person in the operating. And we look at other professions. I remember when PA programs were in the community college system.
Yep,
And
correct. Yeah.
I remember when CRNAs only had to be an ADN. So again, to get that recognition we do need to have that associate degree.
I
I don't
agree.
see changing to an associate in surgical assisting. At I think the associate as a prereq and then their certificate, I think that our graduates are well prepared like that.
Fantastic. And how many cases do they need in order to be able to graduate?
We require 140 cases.
140 cases across all specialties, or do you have a minimum in each one? How does
We
that kind of break
would
down?
like for them to get the 20 cases in general surgery, but the ARC has sort of changed that with the new core curriculum, and there's more flexibility because sometimes we may have, surgical techs that are privately employed.
Mhm.
The main thing that I tell them, I want them to be well versed, and most of them have been able to find those other cases that they need in the other specialties.
That's great. And how do they go about setting up their clinical externship? Like if they are a surgical tech working at a hospital, is that something that you and their hospital representative discuss to get an affiliation agreement?
I It's entirely up to the student to get his or her clinical site. We do have like a memorandum of agreement,
Okay.
and most sites are fine with that since it's a current employee. Some sites do require an affiliation agreement. We have no problem with that. I just tell the candidate that we need to start on that early. Because, of course, gaining an affiliation agreement is a very time consuming thing. But most of my sites are fine with the memorandum of agreement.
Oh, that's fantastic.
It's an employee of the facility.
Okay. And you said it's 140 cases to graduate, and you want them to be as well-rounded as possible. When they graduate, do you encourage them to take one certification exam over the other, or do you, require them to take the NBSTSA once they graduate or the NSAA? How does that work out for you?
Our students are required to take the NBSTSA. That we report that as our data. So
Okay.
they are required to sit for the CFA examination.
Oh, that's great. So would you say that your typical student is a surgical tech working at a hospital that wants to further their education and become an assistant and maybe is in a rural area or has limited options where they are to become a surgical assistant so they can reach out to Fayetteville. Now, is it Fayetteville Technical Community College? What's the actual title? I don't want to get it wrong.
You're right. FTCC, Federal Technical Community College.
FTCC. Thank you. So they can reach out to your program.
North Carolina College with an accredited program.
Okay. Do you guys offer any kind of job placement assistance?
Well, again, with the WBL, our
Mhm.
candidates are currently working, and most of them just move into the SFA role at their current place of employment.
Okay. Let's see. Do you stress the importance of joining a membership organization like the Association of Surgical Assistants or the National Surgical Assistant Association?
Yes, 100%. That's one of the things that I stress early on as part of professionalism.
Mhm.
And of course, when I send them their their notarized letter, I stress in there for them to also join the ASA as well to do networking.
Exactly. And as each one of the organizations, whether it's NSAA or ASA, they have student memberships that make it affordable because they understand that you're under a financial burden while you're going to school. So they want to make those resources available to you at a discounted rate. And like I've said before, I travel for a living as a surgical assistant. And every hospital I go to, I am always asking the assistants I work with, are you a member of the NSAA or the ASA? And do you go to any of their meetings? And the majority of people don't. And I'm trying to improve that because, I mean, they think, well, it's too expensive for CEUs or this or that. But I tell them CEUs are only a part of it. If you've never been, you don't understand. You get to network and meet people. And I
And
mean,
not stress.
mm,
It's part of, I mean, being able to network with other credentialed surgical assistants and see what's going on in other parts of the country.
exactly. And for the legislative updates as well. I mean, there's constantly things moving forward with licensure in many states. And if you can probably hear it on the grapevine, but if you're locked in with going to conferences, then you'll definitely get those updates because I know the ASA and the NSAA and their joint conference, I think the final meeting, I think the final lecture is the legislative update before we adjourn the meeting. So everybody gets to learn exactly where we are with legislation in which state and what state's moving forward. So I think that's fantastic. Where do you see the future of surgical assisting going? Do you see it going away? Do you see it growing? Do you see us what do you
Absolutely
see?
not going away. I think that we're going to see the growth because, as I said earlier, it's the best model, economical model for hospitals. Again, reimbursement's not going to go up, it's going to continue to go down.
Mhm.
I don't think the model of hiring days in the OR is the most economical thing. And surgical technologists that move into that role, they're great. I mean, they understand the OR
Yeah.
aseptic technique. So I think it's only going to grow. And I've seen that in the last few years. And that was one of my things being so passionate about
Mhm.
starting a program to see the move to that because of course technology and the advancement of surgical, these surgeons are needing somebody to do things that's out of the scope of practice for the surgical technologists. And they need these surgical assistants. And reimbursement again, it's not going to pay for two surgeons on a case.
Exactly. When I started my career as a surgical tech, it was right as managed care came in and they weren't paying for 2 surgeons anymore, and it really changed the game.
Oh,
And I started in Fort Lauderdale, Florida, and Florida, I did not I knew a few RNFAs, and I knew one surgical assistant that worked in Fort Lauderdale. He still does, as a matter of fact, fantastic guy. But now almost every hospital, as far as I know, in Florida employs surgical assistants in some fashion. I was blown away to see the profession progress that much in a short period of time, and I think it's just becoming, like you said, more desirable for hospitals to have those duly credentialed people or to just have the surgical first assistants on staff as a service to offer to their physicians.
right.
And
That's why I'm staying here in North Carolina. As I said,
mhm,
when I first started the program, didn't know of any that many in North Carolina,
mhm,
but now I'm having hospitals to call me that they're moving to that model. I know our local hospital hires the SFAs that are in the OR. I mean,
mhm.
city OR, excuse me. And now they want to get the same model in the main OR, especially
Oh,
on chronic cases and
mhm.
endoscopy cases, great cases for SFAs.
Oh, I agree. They're just, I think, a force multiplier. We bring so much to the surgery, I think. And where I am right now, and in this area generally, I would call it the Hampton Roads area of Virginia, eh, because EVMS has been here for so long and put out good quality students that all of the surgeons in this area are used to working with surgicals and rely heavily on their surgical assistants. I know where I am now, the doctors rely very heavily on us. And almost to the fact that we're not there, they don't know what to do because we take
Right.
care of so much for them. I mean, all they have to do is come in and operate, and that's it. And a lot of times in orthopedics, when the case is done, as soon as the implants are in, they move on to the next room and we finish closing. And I just think that is such a game. Just it makes them more flexible and allows them to get more cases in, treat more patients that way. And I think I've traveled to some rural places as well that weren't that familiar with surgical assistants, but now that they've had them, they enjoy them. So, and
John, one thing I tell because I do have students because we're in a rural part of the state, I say the rural places are really ideal for the student because they're not
mhm,
competing against the medical students,
right.
or the PA students. And again, those rural areas really need the surgeons really need that SFA in the OR.
Yep, I agree completely. And actually, I have a relevant story about that. In April of last year, I went to the Maddox Trauma Conference out in Las Vegas, run by Dr. Ken Maddox, excellent, fantastic surgeon. And it's in my opinion, it's the trauma conference. I mean, there were 1,200 attendees there, and these are the people that are creating the treatment guidelines for trauma patients. Like, they're doing the studies, testing things like Reboa, preperitoneal packing for pelvic fractures and stuff. And one of the guys that presented there, he is a surgeon at a rural hospital in West Virginia. And he was talking in his lecture about bringing a patient back to surgery in the middle of the night. And he mentioned how much he dreads it because he has no help. And I went up to him afterwards and I was like, well, where are you? And why don't you have surgical first assistants there to help you? And he said, well, it's a small hospital. We only have 4 operating rooms, but we are hiring them. We are taking some of our techs and putting them through a program because we need help in the middle of the night, or we need help with surgical cases. So to see that it's becoming a lot of surgeons that have gone from big hospitals that have them to small hospitals want to bring that same model to where they are, I guess is what I'm trying to say. So I think it's wonderful.
I mean, some of the surgeons that, we're at a transit place here at Fort Liberty, but
Oh, you mean Fort Bragg?
Fort
Sorry.
Bragg
I'll never call it Fort Liberty. Sorry.
is coming in that's been for other places, and they're like, we need surgical assistants. I'm used to that.
Mhm.
So that the surgeons are starting to make noise. And of course, surgeons make noise, administration listens.
Yeah, that is true. So, and I've had a few surgical assistants tell me that I've never had a surgical assistant until I came here, and I wasn't familiar with them. And I was like, well, you've worked with PAs before, you've worked with nurse practitioners, you've worked with residents where we fill that same role. So yeah, I think that's wonderful. Thank you so much for being willing to come on and tell us about your program. And is there anything else you'd like to add about your program or anything in general that you'd like to talk about?
I mean, John, since we've been in existence in 2019, our average passing rates, and I've gotten great feedback from employers. They have been really satisfied with the quality of our graduates, and I want to keep that going.
Oh, I think that's fantastic. And I appreciate you so much coming on and telling us about it. And I'll put down in the description of when we release the podcast, in the description, I'll put down your contact and the school's contact information, and I can put whatever contact information you want in there. So
My direct contact.
okay,
And they get lost from admissions over to me. So I'd rather be the main contact.
fantastic. Yes, I'll put that in there for you. So yeah, I think that's all the questions that I wanted to ask, and I really appreciate you coming on. So
Yeah, it was my pleasure. I thank you personally for making it happen.
oh, well, you're welcome. Thank you for joining us today. We invite you to like, comment, and subscribe to our podcast. Feel free to look us up on Facebook at The Surgical Assistant Podcast. If you like, you can also email us at thesurgicalassistantpodcast@gmail.com. We look forward to seeing you on the next episode. Content of this podcast is created for surgical assistants and is educational only. It is not intended to diagnose, treat, or offer medical advice on surgical conditions. No patient-specific information is shared, and all HIPAA guidelines will be adhered to.